Hello everyone. Today I'm going to take a class on the topic of tennis elbow. Let's see the synonyms of tennis elbow. These are lateral epicondylitis, lateral epicondylalgia, lateral elbow tendinopathy, and lateral epicondylosis. Tennis elbow. It is chronic overuse syndrome affecting the common extensor origin at lateral humeral epicondyle, resulting in localized pain, tenderness, and painful movements of wrist and forearm. The etiology is repetitive activity involving extension or supination of the wrist and forearm. The pathophysiology is microscopic tear of extensor carpi radialis brevis muscle, reparative mechanism, macroscopic tear which causes the structural failure. The clinical features are pain at outer aspect of the elbow which increases on exertion, tenderness over the lateral epicondyle in the area of the extensor carpi radialis brevis muscle, wrist extension against resistance. Special tests are two tests, namely Cousin's test and Mills test. The diagnosis is done by X-ray, which rules out minimal osteoporosis, marginal sclerosis, and erosion. Ultrasound. Imaging studies, X-ray, ultrasound, and MRI is useful. There are 4 stages of tennis elbow. These are as follows. Stage 1, inflammatory changes that are reversible, non-reversible pathologic changes to the origin of the extensor carpi radialis brevis muscle, rupture of the muscle origin, secondary changes such as fibrosis or calcification. Management. They are prescribed for rest, analgesics, local therapy such as ultrasound and cold compressions, local injections such as steroids, and surgery. Surgical management is done by debridement of the granulation tissue and torn tendon, relief tension at the tendon origin, severing of sensory fibers supplying outside of the elbow. The physiotherapy management is as follows. Treatment techniques are laser, extracorporeal shock therapy, NSAID, electromagnetic field, ultrasound therapy, and phonophoresis. Treatment techniques used are muscle strengthening program like isotonic, eccentric, and concentric wrist extensor exercises. These are prescribed for 10 repetitions for a period of 12 weeks. Eccentric strengthening, 3 sets for 10 repetitions, but here 1 minute of rest interval is given. It is prescribed for a period of thrice a week for 4 weeks. Treatment techniques are stretching of the musculotendinous unit, deep friction massage, Mills manipulation, lateral glide of the cervical spine, lateral glide of the forearm. Self-treatment techniques are also prescribed like tennis elbow taping and tennis elbow bracing. The rehabilitation protocol is as follows. Phase 1 rehabilitation is for 0 to 3 weeks. The goals here are to reduce the inflammation and pain, to promote healing, to break down adhesions, to promote healthy scar. The techniques are pain relieving modalities, deep friction massage. In phase 2 rehabilitation, It extends from 3 to 6 weeks. The goals are to improve the strength of the empty unit, to improve strength of the scar, to promote progressive loading on the muscle unit. The techniques are stretching and strengthening techniques. Phase 3 rehabilitation. It goes for a period of 6 to 12 weeks. The goals are to prevent recurrence of the symptoms, to improve function. Techniques such as plyometric drills, activity-specific drills, repetitive activity and re-education ergonomics are prescribed. Thank you so much. I hope you liked the video. Thank you.